Welcome. This is the training requirements section of the training. These are the training requirements tags with significant changes. Key changes for these tags will be discussed further in this portion of the training. F940, training requirements. Facilities must develop, implement, and maintain effective training programs for all new and existing staff. And that would be anyone who provides services under a contractual arrangement and volunteers. A facility must determine the amount and types of training necessary based on a facility assessment as specified at 483.70E. F941, communication training. A facility must include effective communications as mandatory training for direct care staff. Effective communication is a process of dialogue between individuals. The skills include speaking to others in a way they can understand and active listening and observation of verbal and nonverbal cues. Direct care staff are those individuals who, through interpersonal contact with residents or resident care management, provide care and services to allow residents to attain or maintain the highest practicable physical, mental, and psychosocial well-being. The guidance for F942 is new for the Phase 3 requirements. We drafted language to specify that an ongoing education program must be developed and implemented related to resident rights and facility responsibilities. This program should support current scope and standards of practice and ensure all facility staff understand and foster the rights of every nursing home resident. Additionally, we provided surveyors with probes to assist in their investigation. This includes the use of interviews, observations, and record review to investigate concerns with staff knowledge and understanding of resident rights and facility responsibilities. F944, QAPI training. Facilities must conduct mandatory training for all staff on the facility's QAPI program that includes the goals and various elements of the program. The training should also include the staff's role in the facility's QAPI program and how to communicate concerns, problems, or opportunities for improvement to the facility's QAA committee. As updates are made to the facility's QAPI program or goals, the facility's training should also be updated and staff trained on the updates as appropriate. There should be a process in place to track staff participation in the required trainings. It is not required to have an outcome deficiency to be cited for this tag to be cited for deficient staff training. F945 is a new Phase 3 requirement specific to infection control. All facilities must develop, implement, and permanently maintain an effective training program for all staff, which includes training on the standards, policies, and procedures for the Infection Prevention and Control Program, as described at 483.80A2, that is appropriate and effective as determined by staff need. Guidance has been written to address infection control training. It is important to note that changes to the facility's population, community infection risk, national standards, staff turnover, the facility's physical environment, or facility assessment may necessitate ongoing revisions to the facility's training program for infection prevention and control. All training should support current scope and standards of practice through curricula, which detail learning objectives, performance standards, evaluation criteria, and addresses potential risks to residents, staff, and volunteers if procedures are not followed. There should be a process in place to track staff participation in and understanding of the required training. Surveyors can utilize interviews, observations, and record reviews to determine the following. Did staff observations or did interviews with residents and/or resident representatives indicate a training need? Did staff report and/or did the training records indicate the staff member did not receive training on the concern identified by the surveyor? What process does the facility have to encourage staff to express concerns and request training in challenging situations? Does the facility respond to staff's concerns and requests for training? Review the training coursework to determine if the content meets professional standards and guidelines and covers facility policy and procedures for infection prevention and control. Does the facility implement the training program and ensure staff are instructed to meet the requirements of 483.80A2 infection control F880? Finally, surveyors should verify that the facility has a mandatory requirement that all facility staff participate in infection prevention and control training with a process in place to track participation. F946, compliance and ethics training. The operating organization, the individual or entity that operates a facility, for each facility must provide a training program or another practical manner to effectively communicate the standards, policies, and procedures of the compliance and ethics program to its entire staff. There should be a process in place to track staff participation in the required trainings. In addition, for the operating organizations that operate 5 or more facilities, annual training for staff on the compliance and ethics program must be conducted. F947, nurse aid training. All facilities must develop, implement, and permanently maintain an in-service training program for nurse aides that is appropriate and effective as determined by nurse aid performance reviews and the facility assessment as specified at 483.70E. There are a variety of methods that could be used to provide training. For example, nurse aid training may be facilitated through any combination of in-person instruction, webinars, and/or supervised practical training hours, and should be reflective of nurse aides' performance reviews in order to address identified weaknesses. When able, each nurse aide should be evaluated based on individual performance, and the facility should develop training that can be utilized and beneficial to all nurse aid staff when applicable. F949, behavioral health training. We drafted language to specify that behavioral health training must be developed, implemented, and maintained for all staff. The training must be appropriate and effective as determined by staff need and the facility assessment. We discussed the competencies and skills that should be included in the behavioral health training. Areas that were discussed include person-centered care and services, interpersonal communication, meaningful activities, environment and atmosphere, and pharmacological approaches to care. This also includes the needs of residents diagnosed with a mental, psychosocial, or substance use disorder, a history of trauma and or post-traumatic stress disorder, or other behavioral health conditions and the needs of residents living with dementia. If you have questions about this training, please send them to the DNH triage mailbox at DNH_triage team at cms.hhs.gov. Thank you for your continued efforts towards our shared goal in providing quality care to America's nursing home residents.